And I've heard you say on your podcast that this genetic education should be empowering, not intimidating. And that is exactly what you do through your podcast. The very name of your podcast, the Positive Gene Podcast.
I had this a brain dump of questions, right? Not just that first day I was sitting in our home office and the kids are playing in the next room. I've started writing down, okay, what is Lynch syndrome? I know she told me, but you know how you're in the moment and your heart's racing and that tends to get in the way of your mind. Like when I reflect on the conversation now, I remember where I was sitting, how the light was coming into the office that day and my kids playing in the next room, but I couldn't tell you a word she said to me, And so I had to, again, give myself that moment to let it digest. And then immediately I was, going down the Google rabbit hole. Not only did I start making a list of questions, and I was adding questions to my notes app on my phone. And I think at one point I reached about 40 some questions, topics, ideas, things I had in my mind of like, what if, or how do I get this information? I started seeking podcasts and I came across Force. And so that helped answer, some questions. And I'll talk about Force here in a few minutes. But, I started organizing those things into topics, right? And I do marketing and communications. That's my job. And so oftentimes I'm looking for themes in things. And so I started to do that. I started grouping these into potential topics. And I was having a conversation with my brother-in-law, my sister's husband, and he's like, you should do a blog or something. And I said, oh, I'm not a big fan of writing. And so, but I do love to talk. And so with my voiceover background, I already had a setup at home with a microphone and an interface and, my studio space. And so it was just, it just dawned on me that, gosh, I have to have a podcast.
This is Genetics for Healthcare, a podcast for patients.
This is Genetics for Healthcare, a podcast dedicated to patients and their caregivers to help them advocate for a precision medicine approach to disease screening, prevention of different diseases like cancer, treatment, and surveillance. You can catch us on geneticsforhealthcare.com. From there, you can connect to all our social media platforms. And while you're there, subscribe, no matter what platform you're on, listening to this on, hit the subscribe button. A lot of people who listen to the podcast may not subscribe, but I really appreciate you engaging with us. And subscribe so you can get updates on incredible new episodes like this one. Today, I'm excited to have Sara Kavanaugh, host of the Positive Gene Podcast, and an incredible talent that's doing amazing things to raise awareness of disease prevention, cancer prevention in this space. Sara, thank you very much for being a guest on Genetics for Healthcare.
Yeah, thank you for having me. I'm excited to be here.
I had to have my fanboy moment because I'm a fan of podcasts. I'm a fan of podcasters, no matter, what your platform is, no matter what you're doing. And obviously we self-select for the things that we're interested in. I've heard you talk about what was happening in your life, what inspired you to start mapping your family health history. And then you sought out genetic testing to determine your risk of developing cancer. Take us back to that moment. What drove you to find out more about your genes?
Yeah. So, I've always been pretty tuned into health in general, but oftentimes it would be a bit at the detriment of my own because, I have health anxiety for multitude of reasons. Some of it really had to do with that family history, right? And so for me, genetic testing was really about getting answers. I grew up knowing that there were cancers in my family, but there wasn't a name for it. And some of those cancers weren't really well understood or spoken about. We just knew, for instance, one of my grandmothers had a quote, female cancer in her 40s. But, at the time, nobody talked about it, right? And so it just kind of hung out there as a cloud of what if, right? And so when my primary doctor sent me to a breast specialist because I have extremely dense breasts, so we wanted this extra layer of, prevention. She suggested genetic testing to better understand my risk. And my parents are deceased. Neither of them had cancer, but there's just not a lot of family understanding, right? So let's understand your risk as we're going to be doing this extended prevention, right? With mammograms and breast MRIs. When she suggested that genetic testing to better understand my risk, it was really when I realized this gave me an opportunity to move past that guessing game or that gray cloud of health anxiety, right?
Yeah.
And so really give me a chance to know. So, in hindsight, I realized it wasn't only about preventing cancer, but it was sort of giving me that permission to seek clarity, and peace of mind as somebody who dealt with health anxiety. And so once I had the information, it was almost like this weight had lifted off for me. Again, it gave me that permission to be like, okay, I actually have some answers here. Maybe that gut feeling that I had, why we had this kind of sporadic cancers in our family, this sort of gave me that permission to really get clarity on that. And it felt like I had some direction instead of just letting my mind spin into the unknown. So, yeah.
You mentioned that people just didn't talk about it, and one of the reasons is just, I guess, in the world of healthcare, we just did not know much about cancer as a disease going back, one or two generations, our parents, our grandparents, and maybe for that reason, it was so mysterious and spooky that people didn't speak about it. But when you decided to start mapping this and open yourself up to speaking to other family members about, this and finding out your family's health history with cancer, how receptive were your family members to have the conversation? Were they hesitant, or did this kind of create some anxiety for folks?
Yeah, it's been a little mixed, right? Some are more apt to be open to testing. My sister, who has been public about her diagnosis, has also learned that she has Lynch syndrome. And I could really back that up, or right out of the introduction there, was that I'd found out that I have 2 genetic mutations when I did get the genetic testing results. And one was Lynch syndrome. The specific mutation is in the MSH6 gene. And then I also have a CHEK2 mutation. And with Lynch syndrome, that puts me at increased risk for colon and endometrial and some other cancers, but those are the 2 that are pretty significant risk. And then the CHEK2 puts me at increased risk for breast cancer. Depending on the variant, there are varying degrees, right, of risk. But my sister, about a year ago, she decided to start the process of getting genetic testing. And it took her about 6 months to finally come to agreement that she wanted to do this. And so I joined her for her genetic counseling call, and we talked through, a bit more about the family history and the things to consider, and just that mindset, and I'll speak to this probably a little bit later about the importance of genetic testing or about genetic counselors specifically. You'll hear on my show, I'm a huge advocate for genetic counselors. I think they are such a gift to our community because their role is to not only figure out what genetic testing is appropriate for you based on a conversation with you about your family history, but they're also counselors. So when you leading into the conversation, they help prepare you for what may be to come. So I think you get that sense of like what's coming. And then, when you do get your results and you do have a positive, they are trained to really dive in and understand, what are you thinking right now? What questions do you have? Here are some resources to really give you a stronger sense of what's coming for you. And in addition to that, obviously, the really practical, tactical things like sending you to the NCCN guidelines or pointing you in the right direction for what the screening guidelines are. And those are not fixed. And so staying in step with the genetic counseling community is really important. So, yeah. I totally went off a little bit on a tangent there about the family. Yeah, but I will add, like I said, my sister, again, she was, had an open mind. I think she wanted to give me some time to really explore the process and let me kind of work through it. And then she has gone through and done her own journey. And she did test positive for one of the mutations. And then we have a brother who has said, I'm okay, not knowing. I know that you guys have this increased risk. There's a good chance that I do too. And, I hound him a little bit. I'm the little sister that's going to poke and annoy him with making sure you're getting your screenings done, so whether he gets a test result or not, he knows that there's a risk in our family, and we'll do the right thing to make sure he stays on top of it.
Well, I want to go take a step back, because you did, and thank you for your transparency for sharing that you tested positive for not just one, but two genetic signatures that increases your risk for multiple cancers. You mentioned the anxiety and the hesitancy even before taking the test, and what you need to find out, the conversations you want to have going into being counseled before you take the test. But then it's a whole nother situation after you get the test results and find out that you have a gene mutation that increased your risk for developing a cancer, and you had two. How did that hit you? How did you even process what to do next?
Yeah, I mean, it hit me in two ways, right? Two layers. One is that gut punch, right? I was at home, my kids were here, and I got the call from my genetic counselor, and she's like, "Do you have a few minutes to chat? I have your results." And I don't know, I just could hear it in her voice, like, this is a conversation you're probably going to want to sit down for. And it's a strange feeling, because you don't know what you're hearing. You have two mutations, but in the moment, you don't. What does this really mean? Like, how likely is it that I will have cancer when I hear that I have two, not just one, but two genetic mutations? And honestly, we just did this test out of just an extra layer of precaution. I wasn't one of those people who, is reacting to a cancer diagnosis, or, from themselves or in their family. Right. And so, so it was a gut punch for sure. I was scared. And I just remember sitting in that room, and my kids were playing in the next room, and just thinking about them. Right. Just like my immediate thought went, what does this mean for my kids? What does it mean for our future? What do I need to do? Your brain is spinning. Right. But as I mentioned in the introduction, after I could just take a moment to pause and take it all in, it did give me that strange sense of permission. Like I said, it was like, instead of worrying about all of these vague possibilities, like I didn't have any symptoms or anything that led me to do this, right? But I had real information. I had science to support this, right? And so I could do something about it. So there's a little bit of a sense of relief. I didn't have to argue with myself that I was overreacting, right? That, oh my gosh, like I said, before, that health anxiety was maybe percolating in the back of my mind for a reason. And so really, I think we have to balance that sense of, where you let your brain kind of get ahead of you when you see something that doesn't seem right or feel right, versus letting logic set in, right? We're sort of, those of us with health anxiety are often balancing that, right? And so at this point, then I started to realize I can start taking some concrete steps. And so when I started doing the research, I started thinking, what is the next question? What do I need to do next? And then what next piece of information do I need? And when I turned on that curiosity mindset, everything just kind of settled a bit, and I was able to start moving forward, right? The first thing I did, though, was call my sister. So, yeah. So it's good that when you have a support system, right, to get that news and then have somebody to talk to right away. While I had a great conversation with my genetic counselor. In fact, she's been on the podcast. She was one of the first episodes that I did with a guest. And it just gave me some comfort to know that I had somebody that I could go to if I had any questions. I didn't feel like I was on an island. So,
that's awesome.
Yeah.
Well, so somewhere along the journey, you were just speaking, you had a mindset shift, right? To see these genetic test results, not just a source of anxiety, but as a source of strength and opportunity. And you mentioned that you started making forward-looking decisions in that place of strength. Not only just encouraging people towards, a similar mind shift, but you took some preventative measures. What decisions did you make as a result of your genetic test findings?
Yeah, in terms of really big decisions, I guess you could say. I mean, big decisions in cancer prevention are often a prophylactic surgery, right? And so one of the first things I did was to find a gynecological oncologist. So once I started digging into my Lynch syndrome mutation, uh, I learned that I had up to a 49% increased risk of endometrial cancer. And then there's also an increased risk of ovarian. And so I started reaching out. In fact, I used a Facebook group. I joined the various support groups that you can find for your genetic mutation. So if people are listening and aren't sure where to start, a good place to start is Facebook support groups because they can be a wealth of information. And so I reached out to some folks on a Lynch syndrome board or group, and I ended up finding my gynecological oncologist here in Nashville. And it was a great decision because she was one of the I guess you could say, one of the best reputations, I guess you could say, for this space. She was very familiar with Lynch syndrome. She'd had several patients in her past. She was one of the doctors. Her name's Dr. Laura Williams. She's no longer at Stonecrest, but she has since retired. But she had set really the standard for women having hysterectomies in terms of their program and in preparing you for the surgery and what all the work that went into that. And they did a great job of communicating. And so I knew I was going to the right place in preparing myself for that. So that was one big decision, was having a preventative surgery. Now, when people find out they have Lynch, that's not, women specifically, that's not always the first thing you're going to do, but you do want to start researching your risk. So for me, not only did I have the genetic mutation, and there are varying degrees within Lynch syndrome. There are about 5, I guess you could say, because there's like a 5th one, but I won't go into that details. But there are specific genes within Lynch syndrome. And then within each of those variants, you have different degrees of risk, right? And so the fact that I had mentioned previously with one of my grandmothers having some form of a female cancer and had a hysterectomy in her 40s, we knew that there was a good chance that my risk, and this is based on a conversation with a genetic counselor as well, they can help you assess this, but taking that information, family history, genetic mutation, and my age, because I was 48 at the time, that, you want to weigh all of these things in having this conversation. Not to mention, I was close to menopause. And so having my ovaries removed wouldn't be as significant as it would be, say, for somebody just learning this in their 30s, right? Or early 40s when they still have 20 years before they reach menopause. And so having the hysterectomy, having your ovaries removed, it isn't just this, it isn't about the surgery. This is really a life shift with going into surgical menopause. And so I spent a few months digging into this, having conversations with other women that had been through it, talking to other medical professionals in my community and in my space. And I did resolve to have the surgery. And so I would say that was one of the biggest decisions that I made. Most of this big decisions are really relating to prevention and screening. So I talked about prevention from the endometrial cancer risk with Lynch syndrome. But then with my colon cancer risk, because there's a slight increased risk with CHEK2, but also for Lynch. And Lynch, it can be up to 44%, depending on your specific mutation. And so I was already on a 5-year plan for my colonoscopies because I had a grandfather who had colon cancer. And so I was already on that 5-year plan. And when I reached out to my gastroenterologist, and he's like, all right, let's get you in. Let's get this process going. And he recommended every 2 years. Some people with Lynch syndrome might have even more, maybe a higher penetrance mutation. And so they go annually. If you also have Lynch syndrome and you have polyps at every colonoscopy, they might have you do it even more frequently. So it's not a small change, right?
Yeah.
Going from the 5 or 10-year plan, depending on your risk, to now going once every year or once every 2 years. And then every 4 years, so every other colonoscopy, I have an endoscopy because there are other GI cancers associated with Lynch syndrome as well. And so, that was a shift. So making that decision to then reach out to my gastroenterologist, who fortunately also was pretty familiar with Lynch syndrome. And so we got on a cadence and got the ball rolling there. And then the last one was, obviously, I was already on kind of alternating screening for my breast health, right? So prevention of breast cancer. I do breast MRIs and mammograms. I alternate them every 6 months. And then other things that are related to like some skin cancers associated with Lynch as well. And because there is some family history with basal cell carcinoma, I do an annual skin check as well. And so getting your head around all of these screenings, it's significant. I'm a few years into it and it gets easier, I think, but at first it can be really overwhelming. I think just that anxiety that happens with each of these visits, that does get better. But I think cost can often be a factor as well for people if you have, maybe insurance that is a high deductible, or you have challenges with that. So
Yeah.
I hope that was a really long-winded answer to your
No,
question.
I call it robust.
All right. I like that.
Well, here's the deal. You said something, and I want to make sure that our listeners and those who are watching this really capture those nuggets, because you mentioned a lot. But I'm going to just point out two things that you said that I want people to make sure they make note of. Is that if you understand and have gone through genetic testing and know that you have a gene aberration, a variant that increases your risk in this conversation of different cancers, there is a possibility that your insurance provider will pay for increased screenings. So, as you mentioned, what's typical is a colonoscopy every 5 years. I think they've lowered the age. We'll have that information for clarity on the episode page of Genetics for Healthcare. But as you mentioned, you also went to a provider who understood the significance of you having that genetic variant, and they were able to take action. So in both cases, if you know it, you're empowered to talk about it with your care providers. If your care providers don't understand the significance, bring in resources, bring in links to show them, to educate them, because they may not be aware, and get them to advocate for you on behalf of your insurance to ensure these screenings can be covered by your healthcare provider. You're very much a champion for hereditary cancer testing and preventative health, period. And I've heard you say on your podcast that this genetic education should be empowering, not intimidating. And that is exactly what you do through your podcast. The very name of your podcast, the Positive Gene Podcast, elicits a few images in my head. But tell us why you decided to start the podcast and the inspiration behind the title.
Yeah. So, I had this like a brain dump of questions, right? Not just that first day I was sitting in our home office and the kids are playing in the next room. I've started writing down, okay, what is Lynch syndrome? I know she told me, but you know how you're in the moment and your heart's racing, and that tends to get in the way of your mind. Like when I reflect on the conversation now, I remember where I was sitting, how the light was coming into the office that day, and my kids playing in the next room, but I couldn't tell you a word she said to me, And so I had to, again, give myself that moment to let it digest. And then immediately I was, going down the Google rabbit hole.
Yeah.
And, so not only did I start making a list of questions, and I was adding questions to my notes app on my phone. And I think at one point I reached about 40 some questions, topics, ideas, things I had in my mind of like, what if, or how do I get this information? I started seeking podcasts, and I came across Force. And so that helped answer, some questions. And I'll talk about Force here in a few minutes. But, I started organizing those things into topics, right? And, and I do marketing and communications. That's my job. And so oftentimes I'm looking for themes in things. And so I started to do that. I started grouping these into potential topics. And I was having a conversation with my brother-in-law, my sister's husband, and he's like, you should do a blog or something. And I said, I'm not a big fan of writing. And so, but I do love to talk. And so with my voiceover background, I already had a setup at home with a microphone and an interface and, my studio space. And so it was just, it just dawned on me that, gosh, I have to have a podcast. And so I started doing that, grouping things, coming up with ideas. And the first season was really just that mental, cathartic conversation with myself. I didn't even know if anyone was listening right away, but it was really a conversation on the questions that I had right out of the gates. And so started working towards that. And then I was able to start building a community. And so I mentioned Force. And for your audience who isn't familiar with Force, it is Facing Our Risk of Cancer Empowered. They are a national nonprofit for people facing hereditary cancer and cancer risk. And so they serve pre-vivors like myself. And that might be a new term for your audience or not. I'm not sure. But pre-vivor is somebody who has a genetic predisposition but doesn't have cancer yet, or hopefully will never have cancer. So we're previving. And then they also serve the survivor community. And then they also serve families that are impacted by hereditary cancer. And so, really finding that organization was such a blessing that, within a year's time, I felt confident enough to say, what can I do? Can I help you guys in some way of my learnings and the network that I'm starting to build in this community and start, supporting others that are facing this challenge, because it can be pretty daunting. People come into it with very different perspectives. Some people find out their risk, and like me, they get, it's very stressful and overwhelming at first, but then they find answers and they're good. But then you have some people, they're like, maybe apathetic. They're like, well, I kind of always knew there was something looming out there, and they may not get as anxious about it. Hopefully they react to it and do something about it. But, some people are a little more relaxed about that, and that's okay too. So, so that's sort of how I started building on that. And then I also started my advocacy work with Force. And so I now serve on 2 roles for Force. One as a peer navigator. So people who are newly diagnosed that have questions about their mutation. And so they will pair you, they have an intake form, and they will pair you with somebody who has maybe a similar life experience or a similar mutation as you, or maybe they're considering a question. I had somebody last week that had questions about getting a hysterectomy. She's known her mutation for 2 years, but hasn't made the leap to get a hysterectomy. And so they pair you with people with similar experiences, which is great. The second role I have is as a patient advocate leader. And so that really entails outreach to your legislators or people, either at the state or federal level that are making decisions that might impact our community. And so I was able to serve in one way last year in front of the Tennessee General Assembly for PSA testing for men that are at high risk, right, for prostate cancer. And so, I was able to provide testimony on some insurance, legislation that was being considered at the time. And then this week, I am heading to the rally for medical research in DC. And so this will be my first time going to Capitol Hill with Force, and I'm really excited to do that. There are, I think, I can't remember, but most states are being represented, and we have about 10 people going from Tennessee, specifically from other nonprofit organizations. But from Force specifically, there are 4 of us that are going to be there speaking for Force. So it's so interesting how all of this had snowballed into finding out my genetic risk to all of a sudden now I'm doing advocacy work for this hereditary community that I have come to love so much and want to really fight for. So yeah, so that's a lot in terms of how the podcast has really been the catalyst, right? For moving forward and building this community for within Force and, within the Positive Gene podcast listeners as well. So, yeah.
Well,
So I
real
hope they
quick,
answered.
before we move on from
Yeah.
Force, where should people go if someone says, "Oh, you mentioned something, I need to look into that"? Where do they go to get knowledge and get connected with the services that they provide?
Yeah, it's facingourrisk.org is where you can go, and you'll find specific mutation information, specific cancer information, support groups. They do have Zoom calls every month, and it could be down to the mutation level, or it could be just for pre-vivors, for instance. So they have, again, peer navigators. And then another resource I would really recommend is called X-Ray. And what that is a resource. They use their community of genetic counselors, scientists, and researchers and physicians to vet the information that is out there. We're living in an age of misinformation, potentially. And if you come across something that just seems too good to be true, Force their team might have already looked into it. And so they have a team that is really focused on examining the information that's out there related to studies and tests and whatnot. And, it gives you a place to go to check for credible resources. Some we can think of that are really known in the cancer space, right? Like Johns Hopkins or, Mayo Clinic or the Moffitt Center, right? There's Sarah Cannon, there's a lot of hospital medical systems that work in the cancer community space. Those are great. But then you also have studies that you can find, online through various resources, which, we could always provide some of those. And then the other one that I often go to is the NCCN guidelines. And those are what your genetic counselors are typically using to help inform patients on what their screening and prevention recommendations are. So that's a bit more information. I have a couple others here, and maybe you're going to speak to this about. Well, I'll let you ask the question there.
Well, we're all about resources, but let me ask you this. So this is like. Again, we're all about resources and sharing those firsthand experiences. So I appreciate you coming on the podcast to share this. You've interviewed a number of people on your podcast now of various backgrounds and levels of expertise for patients, patient advocacy groups. What do you see as a common thread? And there may be plenty, but what bubbles up to the top of your mind is, first as what people need most when they're trying to navigate their genetics for healthcare journey to prevent cancer?
Yeah, I think the most common thread I see is that lack of genetic risk. And, you could be having, well, let me back it up to say, a lot of people find out they have a genetic risk because they've had a cancer diagnosis in their family, whether themselves or a family member. And so somebody will get tested and then they'll do cascade testing, right, throughout the rest of their family, and they'll find out that way. But that's reactive, not proactive. And so I think that people not just only having conversations with their family members about what their family risk is, but thinking about other things, that are related to, if you have had a family member that had cancer under the age of 50, or a family member that had multiple cancers, or you have multiple cancers across one side of the family. Like, some of those things are just, we don't often think about them in that context, but those could be red flags. And so I think it's really just that genetic risk, thinking through that genetic risk. And then the other thing I think is, again, back to those family stories, right? And so-and-so had breast cancer, grandfather had colon cancer, but they're not connecting the dots. And so genetic testing, I think, helps close that gap. People don't maybe realize the difference between maybe a family suspicion, with all these cancers sporadically throughout their family, and maybe a scientific a scientific confirmation, and maybe until they're already facing a cancer diagnosis. And so we talked briefly about the genetic testing, but making sure that you get the right testing. So I would say, again, the lack of awareness of genetic risk, again, is like the common thread. And again, that the family stories only go so far. You need that scientific confirmation to really suss out those suspicions. And then the last piece, and this is really more of a tactical piece of it, but it's the right kind of genetic test. Ancestry DNA or 23andMe, they're fun. I've done it. It's really interesting, some of the things that you can get out of those consumer tests. And they will identify maybe a little bit of a red flag here and there. Like mine told me I'm at risk for celiac disease, for instance. I'm like, I don't have a gluten allergy or anything like that, but it's like, okay, maybe I need to talk to my doctor down the road about that, right? But it's not going to be specific to cancer genes. And so really knowing that you can say, hey, when I mentioned I'd done 23andMe to my breast specialist, she was the one that suggested the genetic test. She's like, okay, this is not the same. And so, really making sure that you're getting the right test with a full medical picture. And so when you go to that genetic counselor, or your doctor can even order the test and they can connect you with a counselor. But it needs to really be interpreted by an expert. And, as a resource, if you need to find a genetic counselor, because I couldn't push this enough, I think, on your show, but nsgc.org is where you would go to find a genetic counselor. In fact, they have it. It's really easy to find on their website. But they not only walk you through your family history, but they'll talk through your risk factors and then making sure that you get the appropriate panel. And there's varying degrees of what those panels look like. There's one with 29 genetics to all the way up to in the 50s somewhere, let's say. There's a multitude of tests to pull from. But they will also help you through any of those kind of false reassurance, maybe missing information. And it makes really the difference to help guide you in prevention and screening. And I think another thing that I haven't spoken to yet with relating to getting a positive test result of a genetic mutation, a cancer mutation, is that can often inform your treatment. So say you do have cancer. If you have a Lynch syndrome or another mutation, knowing that information can also inform your treatment plan, because say Lynch cancers might react to chemotherapy differently than, say, immunotherapy. I'm not a medical expert, so I can't speak to that. But what I can say is that genetic information is really critical to your treatment plan. And so you mentioned earlier in the show, hey, if you're working with a physician who has experience with your mutation, I'm fortunate that, I say I'm fortunate, but it's all relative here. But, my physicians were familiar with Lynch syndrome. I have a mutation that is fairly well known in the medical community. About 280 people have Lynch syndrome. Most people don't know it, but it's more people than BRCA. And I think more people are familiar with BRCA or BRCA because of the Angelina Jolie effect, right? And so if we could have the same with Lynch syndrome, that would be a message of mine, like, hey, if you do have these risks in your family that are related to, female reproductive cancers and colon cancers, Lynch syndrome could be a culprit. You don't know. But again, that would help you not only inform your screening and prevention in the future, but should somebody in your family have cancer, this could help inform their treatment plan. So so those are some of the threads, I think, really bringing that awareness, on the front end of finding out your diagnosis, all the way to, how do you prevent it? How do you share that information across your family too? So, yeah.
So rich, so rich. The information you're giving is so rich.
Thank you.
I always ask my guests who come on, because there's somebody watching this who is looking for answers to their complex, healthcare decision or healthcare situation, or they're looking to make a decision and are educating themselves, or it could be a loved one and they're doing the research to find out where did it come from? How can I prevent this for myself? What are some practical tips? Now, mind you, we've been talking about, you've been giving us practical tips the whole time. So this is more,
Mhm.
more or less a recap. But I really like to end conversations with at least 3 practical tips. And it doesn't have to be 3, but
Sure.
3 practical tips that you can share with our audience to empower them to go forward and take action in some way based on these results.
Yeah, I would say the 3 tips, the first one I've mentioned a couple of times here is being curious. It's a mindset, right? Going from fear to curiosity. And there's research to back that up too, but that's for another conversation. But, really in this context, it's uh, gently leaning in, right, to finding out what you've learned. If you are, have recent test results, you don't have to dive into medical journals, right? I'm a few years down this road, and so I have my resources, and I do research because of my job as a podcast host in this space. But there are so many great resources out there, from podcasts like yours to newsletters, from providers, nonprofits that work in your space. Within the Lynch syndrome space, not only Force, but there's Alive and Kickin', for instance, right? And within each of those nonprofit communities, they have resources available to you. So definitely look into that online. Find your, resources maybe on Facebook support groups, for instance. It's a great place to do that. And just know you're not going to become an expert overnight. This takes time. Set the pace that's right for you. If you're not the researching type, like I said, you can listen in, find podcasts. Podcasts are so accessible and free, and you can get recommendations from folks, or like yourself, pointing people to other resources that are out there, which I think is fantastic. And I think too, you hear other people's stories, which is, a lot of podcasts are really told in story form. And I think that helps people feel a little bit more in control. And then it's also easier to sort of understand the landscape of what you're facing. So I think that's a good place to start. Advocacy, newsletters is a great place. And then just start small with your physician. When I first got my diagnosis, I immediately sent the download to my primary, and we had an appointment for later that week. And she said, I need a week to dive into this. And so we rescheduled the appointment so she had more time. Now, I think you're going to find too, just as a side, a lot of, primary doctors, your family doctors, they have so many things they need to know, just dealing with the day-to-day with patients. Understanding genetics is, it's a lot to ask, to be honest. And so, I appreciate that she had an open mind, and I think most doctors are going to have an open mind and be willing to listen to you, and they can point you in the right direction, right, to resources. So bring some questions with you, or bring somebody with you who maybe is more apt to ask questions, right? So I would say that's the be curious side of things. It doesn't have to be complicated. And then the second thing I would recommend when you do get your genetic results is to stick to your screenings. It's a lot, but get a notebook or get an app on your phone that helps you keep track of these things. I think the other thing that people get challenged by, as I mentioned, was the anxiety or the screening scaries, that especially in the early days, if you haven't had a colonoscopy yet, you're going into your first one. That's a big one, because the whole prep experience, this is like 3 days of leading up to the actual procedure. So you can see how that can affect people. So it doesn't have to be that way, and it does get easier each time. But just know what don't dig too far into the research. Don't go down the Google rabbit hole and, find, scary things that you can find online. There's going to be all sorts of things out there. I think really talking to your medical professional about what questions you have is really the way to go. But again, the relief you feel afterwards, after your procedure, it's done, the weight is off, and for another 6 months or 12 months or whatever it is, I think, I picture myself walking out of that appointment with a sense of relief. And so that provides me some lessens the anxiety, I guess you could say, is really that visualization of being done with the appointment. So that's a little bit of a tip there relating to the screening side of things, which is such a big part of living with genetic or hereditary cancer risk. And then the last piece is finding your people. Being a pre-vivor is kind of an in-between space, right? You don't have cancer, but you live under its shadow. And so sometimes it can feel a little bit isolating, even to people closest to you, right? If they don't understand, why do you go to all these appointments, or why are you nervous about this? It's just a test, So it's there, it's real.
Yeah.
But I had a close friend diagnosed with cancer in the last couple of years, and I could empathize with her deeply, but I found myself wishing that she had the same knowledge that I did, right?
Absolutely.
And having that genetic information isn't 100%, prevention, but it does empower you to be proactive. And so that's a gift. And so a chance to stay ahead of it, again, to be empowered and know that if a diagnosis were to come, that I did everything possible to catch it. So
Absolutely.
yeah, so those are my 3 tips.
Powerful information. Sara
Thank you.
Kavanaugh, cancer pre-vivor and host of the Positive Gene podcast. Sara, let folks know where they can connect with you and find your podcast. And she's also a tremendous voice talent, by the way.
Thank you. Well, I am on Instagram at Positive Gene Podcast. The podcast is of the same name, so you can find me on all major streaming platforms. I'm also on LinkedIn. I really appreciate connecting with people on LinkedIn under Sara Kavanaugh, and be happy to connect with anyone if they have any questions, would like to learn more about the resources that I mentioned today. So thank you for having me. It's really been great, and I'm really enjoying watching your show grow as well. So thanks for having me here.
Thank you. Okay, so I got to ask you, so when I say she's a great voice talent, I mean, like, you've probably heard her voice on commercials and things. What's the craziest job in terms of voiceovers that you've gotten?
Yeah, a lot of the work that I do is mostly internal corporate, like e-learning, explainer videos, corporate videos. I've done a little bit of commercial work, mostly on the local side of things. So they're like web commercials for a church or a nonprofit. So yeah, fortunately, I haven't had those big gigs like the Home Depot or big sporting events or the Voice of God yet, right?
Yeah, it's on the way because you're doing the most good for people who need it. Thank you for being a guest on Genetics for Healthcare.
Thanks for having me.
This is Genetics for Healthcare, a podcast for patients.